if you could tell people who have no idea what the difference is, what is the traditional approach to dentistry versus the holistic approach?
Imagine a sick fish in a dirty bowl of water, right? So if we want to cure the fish, then we can either medicate the fish or we can change the terrain, meaning the water. So that's what holistic dentistry does. I help clean the terrain instead of just putting medicines in someone's body, and help them heal, remove the toxic substances from the mouth, because we cannot achieve general health. We all want to be healthier, and we cannot achieve health if your mouth is not healthy. I see 3 to 4 patients or 5 maximum in a day. So there is going to be a difference. And the reason is that I spend time with the patients first. That is the first and most important thing, because I really want to heal them. Then we start talking to you about your diet, your nutrition, your oral hygiene habits at home. We check the pH of the mouth, and if your pH is constantly staying acidic, then I can tell you have some gut issues and they need to be addressed. We check blood pressure, we evaluate you for gum infection. So we check like 6 points around each tooth yearly, sometimes more frequently if someone has gum disease. We are able to send the samples of the plaque to laboratories to find out what exactly is causing problems in your mouth, what bacteria, and then we can treat accordingly. We take a lot of pictures. I study them. I study your bite. We check how much your mouth opens, and if it's not opening to the normal range, why is that? Do you have any aches or pains? How are your muscles? Are they tight, or do they pop out when you clench your teeth? Those kind of things.
Welcome to Polish Your Life, and today we're going to talk about holistic dentistry. What is a holistic dentist? Why you should see one, and also some tips for you that maybe you didn't know about holistic dentistry. And this is if you are a provider, and also if you're an individual looking for clinical solutions. I am here with an amazing guest. This is Dr. Mansi Oza, who is a holistic dentist in Thurmont, Maryland. We're going to be asking some questions and letting Dr. Oza educate us on why this is important. Dr. Oza, welcome to Polish Your Life.
Thank you, Mike. I'm honored to be here, and I hope to be helpful to someone move towards healthier life.
Thank you. This is awesome. So maybe let's start with the basics. If you could tell people who have no idea what the difference is, what is the traditional approach to dentistry versus the holistic approach?
So I will tell you what my mentor once told me. So imagine a sick fish in a dirty bowl of water, right? So if we want to cure the fish, then we can either medicate the fish or we can change the terrain, meaning the water. So that's what holistic dentistry does. I help clean the terrain instead of just putting medicines in someone's body, and help them heal, remove the toxic substances from the mouth, because we cannot achieve general health. We all want to be healthier, and we cannot achieve health if your mouth is not healthy. So that's what holistic dentistry does. People use different terms like holistic dentistry, biologic dentistry, functional dentistry, integrative dentistry, and my own term is oral wellness. And I honestly don't think it matters. Basically, we all need that deeper knowledge about how we are healing people, instead of just saying just floss and use mouthwash and you'll be okay. So yeah, that's what it's all about, finding the cause of the disease. Like, you interview a lot of functional medicine doctors, it's the same thing. And, so their whole body improves.
Yes, and this is pretty amazing, because a lot of people, when they think about a dentist and dentistry, when they hear the word root, they think about root canal. But we are talking about the root cause of the problem. The same thing, and I love the terminology that you're using, because we are here inviting integrative medicine providers, functional medicine providers, and we all collaborate. And dentistry is an integral part of our health, instead of just a cosmetic approach to how we look. And I think this is very important for people to know. So off camera, we were talking about, I look at people's mouth and I can tell a lot about their health through their mouth. And I think this is pretty fascinating. So let's talk about, maybe let's zero in to some of the practical applications of that concept, right? So we look at the body holistically, and now you see a patient walking into your door, and what would be the difference between your approach and a traditional approach?
So we do a lot of things differently. One of the most important things to me is to talk to the patients, right? So most people, like I have worked in a corporate office before, and I was forced to, no, I shouldn't say forced to, but they would schedule like 20 patients in my schedule in a day. Like today, I see 3 to 4 patients or 5 maximum in a day. So there's going to be a difference. And the reason is that I spend time with the patients first. So that is the first and most important thing, because I really want to heal them. Then we start talking to you about your diet, your nutrition, your oral hygiene habits at home. We check the pH of the mouth, and it is just a glimpse, inside the day. It may not give us an accurate information about how their pH stays throughout the days or the weeks, right? But still, it gives me some information. And if your pH is always staying basic, like 6.8 and above, you can never get a cavity. And if your pH is constantly staying acidic, then I can tell you have some gut issues, and they need to be addressed before I put any work into your mouth. I can reconstruct the entire mouth, and it can fail if your acidity is not maintained. We check blood pressure. We evaluate you for gum infection. So we check like 6 points around each tooth yearly, sometimes more frequently if someone has gum disease. We are able to send the samples of the plaque to laboratories to find out what exactly is causing problems in your mouth, what bacteria, and then we can treat accordingly. So basically, I like to be very thorough, and we take a lot of pictures. I study them. I study your bite. We check how much your mouth opens, and if it's not opening to the normal range, why is that? Do you have any aches or pains? How are your muscles? Are they tight, or do they pop out when you clench your teeth? Those kind of things.
Wow, it really is very comprehensive.
That's right.
And that's what a lot of people don't realize, is that our body is a beautifully functioning, as long as we put the body in balance, of course, beautifully functioning machinery, for lack of a better term, that is really with a lot of pieces or a lot of systems that are interconnected. And chiropractors talk about a similar concept, is to look at all of them together, because as long as we give the proper environment, like you mentioned with the fish, that fish has an ability to heal itself. The body has this innate intelligence to heal itself. But if the environment is so bad, or even in the good environment, if we have the interpretation of the environment as something that is really bad, that's something that can block the healing and block progress. So going to the dentist and getting, I even put some notes here, and getting your pH of the mouth evaluated, your gum, talking about your gums, talking about nutrition, talking about, how wide you can open your mouth, and aches and pains that you would think your dentist doesn't care about. You're looking at this holistically. And that's what I want all of you watching, providers or individuals, to know, is that with this type of approach, the collaboration we talk about in Polish Your Life becomes a very important part, because you can synchronize with other therapies to get the patient better. And a lot of it starts with your mouth. So let's talk about the most important, maybe not the most important, but the most common big problem that a lot of people have, but don't even realize. I wanted to touch on toxicity with mercury. Let's talk about that, please.
Yeah, that is huge. And Me myself, I have told you, I have 2 doctorate degrees in dentistry. I graduated from India in '97, and then I went to the Ivy League University, University of Pennsylvania, and I really trusted them, and I still do, because especially UPenn, it is a research-based university, evidence and research-based. They wouldn't advise us anything, or so I thought, and until I was there, I don't know what they do now, but until I was there, I have actually placed mercury fillings in patients' mouth, because it was believed that when it mixed with silver and zinc and all other metals, it wouldn't leach out. But I have been reading and reading, and it has been it's been mind-boggling to find out the facts. And every time we brush our teeth, we grind teeth, we eat foods, there are temperature changes in the mouth. If someone has mercury filling in their mouth, the mercury becomes a vapor, and it actually leaches out of the filling. And we all know that it's a neurotoxin, right? So very, very toxic substance, and it does come out. They do have now meters to actually check how much mercury comes out. Even when you're talking, we can measure it. So highly toxic. And I always tell my patients, like, I have hundreds of patients with mercury, and once I educated myself, I've been educating them, because unfortunately it is believed that those amalgam mercury fillings last a lifetime, and they do, because about 90% of dental diseases are painless. So once it is plugged inside the tooth, you would think that, yeah, it is lasting because you don't feel anything. But once I opened my eyes, I started seeing cracks within the tooth structures. I started seeing cavities underneath. I started cracks inside the filling material itself. And it's just amazing, because it doesn't appear on the x-ray. Patients don't have any symptoms. So I myself believed that, if I don't see anything, if I don't have a reason to remove the fillings, why should I advise someone? And now that I'm doing, I have thousands of pictures of all the mercury fillings that I remove daily. I would say 1 to 2 patients a day. There's always cavity underneath. So if you don't believe in poison part, that is just one reason to get rid of it. And cracks, because it's metal, so it expands and contracts with temperature changes in the mouth, and teeth are always cracked underneath. So many reasons to get rid of that.
Wow. And there are also specific procedures how to do it safely, right? Because it's a
Correct.
neurotoxin, like you mentioned, and it's not necessarily that only touching or direct contact to mercury is dangerous, because we are talking about these vapors being
Correct.
the biggest problem here. So
Correct.
let's talk about the process of safe mercury removal. How does it look like? So let's say I meet someone who I want to refer to you for safe mercury removal, what they can expect.
So first we evaluate, right? We educate the patients. When they come in, they rinse their mouth with a specific solution. It is charcoal, so it is kind of, it absorbs mercury. We all put barriers on ourselves. We have a special, so I'm SMART certified, so that is a safe mercury amalgam removal technique by IAOMT. So that's International Association of Toxicology and Mercury, Safe Mercury Removal. They certify us for that. So going back to the procedure, so we have a specific filter, and it has carbon filter inside the box. So you have a tube, it's like a vacuum cleaner, and it stays close to your mouth, because when we are removing the mercury, it generates heat and it vaporizes. So you, my assistant, or myself, we don't want to inhale it. So that absorbs most of the vapors. The patient is completely covered head to toe. My assistant and I are covered. The patient would have oxygen masks, so they are continuously getting fresh air, and we wear a N95 respirator and carbon masks. We put a rubber sheet on the tooth, so the tooth itself is completely isolated from the rest of the mouth. It actually makes the procedure very comfortable. It doesn't look like it, but you don't have metal particles going down your throat. You don't have water going down your throat, because we do use a lot of water to cool down the tooth. We remove the mercury filling in larger chunks instead of grinding it out in small dust. We have high vacuum evacuation that my assistant holds. So we try to remove as much vapor as possible, and then everything is removed once we are done safely.
Super. And it almost seems like handling biohazard materials, because it is biohazard
It is,
material.
yeah.
And people would sometimes maybe trying to imagine what you just described, and it may look um, like something that they have no idea that they have in their mouth, and it may look a little bit scary. What's maybe just to put people's mind at ease and why they should do it? So first of all, is the long-term effects or side effects of having mercury in their mouth that they need to be concerned about? Because you mentioned that they may not have immediate symptoms, but there are other symptoms that they may not tie to
Exactly.
having
Mhm.
mercury. And because it's a neurotoxin, we talk about headaches, dizziness, and a lot of different symptoms that they may have no idea it's related to what's here in their mouth. So for people who come in, because it sounds like this is going to be like a half a day procedure if you put all these things together, to put people's minds at ease, how long does it take, and is it painful to remove mercury?
So it is just like doing a filling, just in a safer way. Like I said, I do it daily. So we have comfort numbing technique that I have established in our practice. We can also add nitrous oxide if someone wants to be more comfortable. We have overhead TVs, we have neck pillows. So we try our best. Going to a dentist is not fun. I get it. I don't like it myself. We have lavender essential oils. I can give mild sedations, all those things. And the procedure itself is just like doing another filling, just more comfortable, even if it doesn't look like it. But I would say so far, I don't remember anyone who complained about being scared or anything. They are just used to us looking like aliens. So I don't know. I maybe they don't say it, but we haven't had anyone who is scared or anything. So yeah, it's actually very comfortable.
Okay, thank you for explaining. And for people watching this and just wondering, hey, do I have mercury or do I not have? Because you mentioned you cannot see it on the x-ray. So how can one tell if there is mercury in their mouth?
So just to clarify, you cannot see the decay on the X-ray underneath the mercury fillings, not the mercury vapor or the liquid mercury, right? Because it is amalgamated, it is mixed in with silver particles. So you cannot see decay underneath, because on the X-ray, it looks like a white blob of metal. So, but mercury we can obviously not see, but it is dark gray colored silver filling. So it's a metal filling, and it's very easy to recognize, or we can
Okay.
help them if they are not sure.
So even if you look at the X-ray, you will be able to tell, say, okay, this definitely looks like
Correct.
there is mercury filling there because of the
Correct.
way that it was done and what you
Correct.
see. Okay, so that's
Correct.
good. And thank you for explaining, because I think a lot of people should know, first of all, do I have it? And then second, what do I do with it if I do have it? Because it sounds a little scary, quite frankly, to have all this biohazard, surrounding of you, and the vacuums and all the PPE. But at the same time, if it needs to be done, you definitely don't want to be carrying this every single day and night with
Oh,
you.
absolutely not. Yeah.
So that's important for people to know. Let's talk about another one that is very commonly seen in patients and sometimes with no symptoms, is gum disease. Let's
Mhm.
talk about that, and also not only what it is and what can be basically what can be the side effects of having gum disease, because they're for overall body health.
Correct. So yeah, so gum disease is a silent disease. A new study just recently came out just a few months ago, because we are in pandemic right now. If someone has gum disease, their COVID-related complications are 3 times more likely to happen, and that include hospital stay, I forgot the word, ICU admission, right, and respirator use. So very, very important. Diabetes, Alzheimer's disease, high blood pressure, cholesterol, they all can be caused by gum disease. So until now, it was believed that there is a link between gum disease and all these diseases. And now there is now scientific evidence that if someone has gum disease, they are finding the bacteria, and one of the major ones is called P. gingivalis. They are finding that bacteria into the brain of the people with Alzheimer's disease. And you mentioned how amazing the human body is, right? So brain is completely protected, and there's a barrier, and it doesn't let all these toxins or other stuff in. But this oral bacteria can cross the blood-brain barrier and causes plaques inside the brain.
Wow.
So so it's really important to first find out whether someone has gum disease, or if they are starting good oral hygiene habits, using the non-toxic materials, proper techniques, toothpaste and oral hygiene aids are super important. We do our part, so we check, like I mentioned, the gum points or gum measurements, whether someone has gum pockets. We can tell exactly what bacteria is causing the problem, and we can then aggressively treat that. So, yep.
Yeah, very good to know. And I was reading one of the studies, it was years ago, so I don't remember which one it was, but it was something linking gum disease, and I think it was bleeding gums specifically to even pancreatic cancer, which was
Yep, that's right. Yep.
unbelievable, because people may not link one with another, and it, obviously such an important link to know about. So when you say you're checking the microbiome of people's mouth or bacteria in people's mouth, that's something that would also be addressed, because you already would check and you would know that they have the bacteria that we talk about crossing the blood-brain barrier, right?
Correct.
Okay,
Correct. Yep.
excellent.
Yep. And we can also see that, like, if someone has gum pockets, or we can see because the bone gets irritated, it starts to shy away from the teeth. So we can see that on the x-rays too, if someone's losing the bone around the teeth.
Okay. So that's good to know. So again, you open the patient's mouth, or they open their mouth, and then when you look through the mouth, it's interesting because you mentioned that off camera, is you look through the mouth to picture patient's overall health based on what you see in the mouth, and that even is judged by the degree that the mouth can open. And let's talk about another thing, because I wanted to at least touch on that subject, TMJ. You mentioned TMJ last time we have spoken. So tell us a little bit more about TMJ and the bite, and what can be done by a holistic dentist to help with that.
So TMJ is the temporomandibular joint, which is right here. And when we clench our teeth, like you can do it right now, you can see these muscles will fire, they'll get tight. And if someone is constantly doing that, maybe in their sleep or during the day, then all these muscles get pretty bulky. So just by looking at their face, we can tell that they may have grinding issue. And again, I read a lot of studies. So now they are finding that if someone's airway is narrow, then as a result, our body is amazing. It wants us to survive and breathe at night. So it starts to move this mandible, the bottom jaw, forward and in all directions for us to be able to breathe at night. Because tongue is a muscle, so it relaxes when we are asleep and it falls back, clogging the airway even more. So when we pull this jaw forward, the tongue comes forward with it, and it can open the airway. Now, if it is not a controlled movement, and if the body is trying to find the way on its own, then it starts to move the mandible all around, and then people start to grind their teeth. And I have seen some people who have ground down their teeth up to their gum line, just completely gone.
Wow.
And just by looking at it, I advise them to at least get a sleep study done. And they start, because they're putting a lot of pressure on the teeth, it transfers here to the TMJ. And they start having joint issues. I mean, that's not just one reason, but that is one of the most common reasons. So just by looking at it, we can check that. Some people have acid reflux and it is silent, and the enamel is completely eroded, and they don't know. They just tell us, "Oh, I have sensitivity." And no one has looked into the connection between the gut and the teeth. And if you go to regular medical doctors, they would say, okay, just take Prilosec, and they clog and they decrease the acidity in the stomach more. And now the whole body becomes acidic. And, we really need to work together with our medical colleagues who also look deep into these things and not just prescribing medications. And just by looking at their teeth, I can tell that they have some deeper issues. Or looking at their tongue, like just on Friday I was seeing a patient. She has been a patient for a long time. I looked at her tongue and it had these teeth marks on the side. So I said, you have you had your thyroid checked recently? Either you have thyroid or sleep apnea issues. And she said, I was just diagnosed with low thyroid. How did you know? So I said, just by looking at your tongue. And today morning, she actually emailed me. She was like, where do I go for sleep apnea testing? Because she said, my husband tells me I snore at night.
Wow.
So, yeah.
This
So
is
it's,
amazing.
yeah.
Really amazing. And that's what I want everybody to know. And that's, first of all, this is what bothers me personally so much about healthcare, is
Really,
that
yeah.
everyone, they everyone, with some exceptions, let's put it this way, we have some awesome exceptions like Dr. Mansi Oza. Everyone goes to specialize in their own field, and that's beautiful. And I think everybody should know what they're doing. So we talk about GI doctors, chiropractors, medical doctors, general or specific to specific conditions or systems of the body. But a lot of times, all these therapies and all these problems are put in these small bubbles.
Mm-hmm.
And outside of that bubble, there is something that is affecting the condition of the organ. Like you just mentioned, that the tongue and the thyroid can be connected.
Mm-hmm.
Acid reflux can be connected to the health of your teeth and the
Mm-hmm.
health of your overall body. So what bothers me on a personal level is that I see all these people really trying to help, and then when it comes to asking them about another type of therapy, they say, I'm not really trained in that, which is true, that their specialty is X. But the key is to be open and to think about the
Exactly.
body holistically.
Yep.
And now you're watching this, you have a great example of how maybe Dr. Oza doesn't have a solution for acid reflux, but being able to collaborate with a
Exactly.
doctor who's going to do sleep study,
Yep.
acid reflux, with a chiropractor who can also adjust,
Mm-hmm.
every joint can be adjusted, right? So when we talk about, or almost every joint, so when we talk about TMJ, that can also be adjusted. And then being able to refer, speaking about Ryan Diener, right? So one of our co-hosts here at Polish Your Life, Ryan, as an acupuncturist, he looks at people's tongue to
Mm-hmm.
determine their health.
Mm-hmm.
How similar, right? But would you
Yep.
say your
Yep.
dentist will as well? Amazing. So this is what bothers me on a personal level, and at the same time, this is what warms my heart to see that more and more practitioners start collaborating. And now
Correct.
we have this beautiful orchestra and
Mm-hmm.
synchronization of all these different therapies. So imagine if you're a chiropractor watching this and you're thinking about, hey, something's wrong with my patient,
Mm-hmm.
but maybe having a holistic dentist in the picture as part of the therapy or treatment schedule would be a very good idea. So that's to chiropractors. Same with GI doctors. Same with other, especially general practitioners,
Yep.
PCPs. They need to refer to the proper physician. But how do they know who is proper physician?
Correct.
The
Correct.
good thing to check would be to see what is the approach, not necessarily what's the specialty, but what's the approach. Because
Exactly.
even
That's
if
so
they
true.
refer to you first and somebody needs a chiropractic adjustment, what you will do is you will refer to a chiropractor. And that's the beauty of it.
That's true. That's true. And I would like to tell to everyone who is watching, I really need help for my patients because I'm continuously educating them, and I need someone who really gets this. And like you said, I need to know their approach, and so that I feel good that, okay, I'm sending my patients to the right person who also believes that the whole body is connected. And then we can imagine how many people we can really impact.
Yes,
So,
it,
yeah.
it is really amazing that more and more people right now are taking control. And right now I'm talking to individuals watching this, because even if you're a provider watching this, you are also an individual person who relies on the doctor's opinion to lead you in a specific direction. So right now, if you're watching this, I encourage you to also watch a video that we recorded with Dr. Todd Johnsonbaugh, because we are talking about being your own health advocate. And even if you're given advice that doesn't make sense, you can ask a question and you can follow up, because you are in charge of your own body, and it can give you a shortcut that will save you 10 plus years on your treatment. So that's very fascinating to me. And I want to encourage everyone to look for practitioners with a holistic mindset, dentists included. Let's zero in on another thing that I wanted to ask you as a holistic dentist. We are talking about biocompatible materials. First of all, what does it mean that the materials you use are biocompatible? And then what's the importance of them being biocompatible?
So, honestly, it's not everyone needs biocompatibility, but or I should say, everyone does need something that is non-toxic in their mouth. But I would say some people are extremely allergic to the materials we use in their mouths. So there are some tests available, like we can send our cements, our resin material that we use to bond and fill the teeth with, and make sure that the patients are compatible. There are some companies who make those materials, so we use them. They are BPA free, which is, and no one should have that in their mouths. But things like that. So just to make sure that we are not putting anything that is toxic for the body, I have gotten rid of all the metal crowns that we were using. So we, in my practice, have the ability to scan and mill the crowns right there in the office. I design it myself precisely, so there is nothing really encroaching inside the gum tissue, because I make sure I can enlarge everything 90 times bigger. And that I see a lot in when I remove bad dentistry. I'm just sad to say that, but I do every single day. So in old times, we used to use metal with porcelain crowns. And if you really look at the gum tissue, there's a ring around that metal crown, because the body is so allergic to the metals that were used inside those crowns. So now the new technology allows us to actually bond the crowns to the teeth, so there is no leakage. And I can design it precisely right in front of you. So there is no a second appointment needed. And the reason for I like it, because yeah, it saves you time. But mainly because when the patients came back, they came back with so much inflammation because they were afraid to clean that temporary crown, and just the material itself could be allergic to them, and so much bleeding around the gum line. And we have now completely eliminated that. So
Wow,
yeah, lots of things we can do. Yeah.
that's awesome.
Yeah.
I have a little I have a question that may be a little bit different than a standard question, because in dentistry we talk about saving your own teeth, preserving your own teeth. And one of the techniques and ability to preserve your own teeth is to have a root canal done.
Mhm.
At the same time, researching, because there are two sides of the spectrum. One side is, yes, we have right now technology and ability to clean everything and sterilize so well that there is really only a minimal, some people say no risk or a minimal risk of the leakage of bacteria from a root canal. At the same time, on the other side of the spectrum, I did read some of the studies that were very scary, to be honest, because they were linking root canal work, especially the bad root canal work, I'm not saying that everybody's doing it this way, even to the beginning of autoimmune diseases. So because I'm not an expert in this, I just read it and I'm very curious because one sounds great. Let's save your teeth. The other one sounds very scary. Yes, if you do a root canal, you can possibly expect, complications. What is the proper balance between these two, and how do you determine what should be done?
So yeah, that is a definitely very controversial topic. And I'll be honest, I'm not an expert on that either because I have read studies from both sides. What I do for my patients is that if I can treat it in the office, I give them options and make their own decision. Um, there are ways to treat it holistically, meaning that instead of putting chemicals to clean the canals, we can use like more homeopathic solutions. So we are achieving the same results, like there are no bacteria in the canals and still save the tooth. Because, there are lots of, this is where I kind of hesitate in removing the teeth because, once you remove the tooth, unless it's a very last tooth in the arch and you still need it. Like if I lost that tooth, I would be depressed. I need my whole set of teeth. But if it was the last tooth, yeah, we can ignore it. We don't have to replace it. But what if it's a young child who got into an accident and had a trauma to their front tooth, right? So if we start removing the tooth right now, when they are below the age of 18, because we don't want to do the root canal, then they will lose all that bone. They are not yet eligible for a dental implant. Dental implant is an expensive procedure. So what do we do, right? So we can treat that tooth holistically just to kind of buy some time if they are going to replace it with something else in future. But 100% of times, except for some exceptions, we do need to replace the teeth. So if you strongly feel about not doing the root canal treatment, you have to know that the tooth needs to be replaced, and it is a process, right? So what we do, and I belong to a large group of holistic dentists, is we all agree on this, that we treat it holistically and do our best. There are some of us who strongly believe that root canal should not be done because it's a dead organ in the body and it blocks the energy pathways, it affects the gut, and there are all these meridians. Your mouth is connected to your heart and your feet and your lungs and everything. So it is, yeah, it is a controversial subject, but if someone wants me to do the root canal, I would treat it with more natural substances. Yeah.
Understand. And thank you for giving me such a thorough and honest answer on this. It is confusing because you can, just like with almost everything, you can find even science and PubMed, NIH, peer-reviewed studies, and it's, as a patient or provider, it is confusing what is the right approach. So for anybody watching this, I think it's a good idea to consult, evaluate, decide, look at all the information, and do the best that we can. I have another one that may be a little controversial for you, but I think it's important that we mention it. Let's talk about fluoride, because in dentistry, fluoride seems to be the best invention ever. At the same time, it was never meant to be ingested. And you also have these two sides, one saying, of course, we are dentists, we need to use fluoride. On the other side, please never put that in your mouth because it can be swallowed and it can also be toxic to your body. What's your approach and what is your advice on this?
Yeah, same thing as root canals. So, most of the holistic dentists would not offer fluoride. That being said, I work in Thurmont and the water is not fluoridated, and I see huge cavities. So, of course, there are hundreds of reasons why someone gets cavities, but we do offer now a solution. So instead of fluoride, it's a silver diamond that we can apply to the teeth. And if there are small cavities just starting to form, we can stop the progression. And then we can guide the patients towards what actually causes cavities, which would be mainly it's the hygiene or low pH in the mouth. And if we can address that, then, and if they are really going to do all the steps, if their pH is balanced, they are never going to get cavities. So that's what I would do if you feel very strongly against fluoride, and many believe that it is also a neurotoxin.
This is amazing because a lot of people have such a strong opinion and they're sure they're right until the science proves that maybe some things are questionable. So what I love about Dr. Oza is you are evaluating both sides and making a logical conclusion what would be the best, and you educate the patient because we don't know it all, but all we can
Right.
do is do our best.
That's right.
And one thing that warms my heart is hearing stories, because we talk about concepts, we talk about science, we talk about research. Some things are boring, some things are more interesting to other people, but everybody can relate to a story. And I wanted to tell people that Dr. Oza, her passion is to also sometimes, once a year, right, provide one person with a transformation, right, to have their smile transformed. Even if money may be an issue and maybe they cannot really afford, you are doing something for the community to make it happen. And I know you told me about that story of father and son, and I just wanted you to share a little piece of that story, if you don't mind. I want people to know that every procedure also has an emotional impact if you look at it this way. So let's talk about this story, please.
Yeah, so every year, and we are about to announce our next one, like next month actually, and I'm going to post the pictures of this person this Thursday on our social media, Thurmont Smiles. But Nick, his father has been my patient for a long time, and when we announce our free smile makeover competition, which is something that I do from my heart, because I want to share the gift of dentistry, and I know it's expensive and not everyone can afford it. So if I can make a positive difference in someone's life, that's what I'm all about. So once I announced it last year, we also posted some posters in our operatories, and the dad actually saw it, and he's like, and he saw the winner of the previous year, his pictures. So he said, my son needs this. And I said, hey, we have this going on our social media. They can apply, they can tell me why we should pick them. And he did. And his main thing was he wanted to be a role model for his daughter. He had diabetes, and I'm saying this with his permission. He has allowed me to say these things. So he had diabetes, and over time he had just completely stopped smiling. He could not get a job, and he felt that his daughter would have the same life if he did not do something about his teeth. So he won. So when we pick the winner, we individually kind of read everyone's essays, and everyone kind of numbers the people, and then we combine all the data together, and then we bring 3 people in and we meet them, and then whoever touches our hearts, we pick them as a winner. And Nick was picked by everyone all across the board. He just touched our heart, and we started the rehabilitation of his mouth. It took us quite a few months, actually. We provided the treatment at no cost to him at all. And his dad came to his reveal day, the final day, when we were going to, give him the smile of his dreams. And he said he was so excited to see him smile again like he used to when he was a child. And, that just warms our hearts, and that's what we are all about. So yeah, brings us a lot of joy.
That is amazing. The world needs more people like you, the more providers like you. And I'm very happy to have you here because, we are trying to solve a big problem here with Polish Your Life. Many people go from doctor to doctor. Even if they follow recommendations, they sometimes still don't feel better. And it's a huge problem. And almost nobody is doing something actively to help with that. So we want to build a network of 10,000 healthcare providers and individuals who collaborate, share
Absolutely.
clinical experience, and then also it comes with the knowledge and awareness of providers like yourself and different types of approach. And then together, I really believe that we can do so much to help a lot of people. Dr. Oza, tell people who are watching and maybe they want to connect with you either just online because they may be somewhere very far and they want to collaborate with you, or maybe they're very close and they want to come as patients or refer to you. Where can people find you?
So you can email me anytime. So it's Thurmont, that's the name of the town. So it's THURMONT, smiles as in plural. So it's thurmontsmiles@gmail.com. I'm also very active on Facebook and Instagram. So you can just direct message me there. The handle is the same, Thurmont Smiles. Or they can reach out to you, and I'm always available to answer any questions if anyone has any.
That's awesome. Thank you so much for the interview.
Thank you. Thank you. I really enjoyed it, and I hope that we helped someone today.
Oh, for sure. For sure. Somebody said that even if we help one person, it was worth it. But I know that right now, with the power of the internet, that interview is going to stay online, and I think we're going to help many more people than just one.
I hope so too.
And thank you for watching. Till next time. Bye.
Thank you. Bye.